If you're working past the age of 65, one of the very first questions about Medicare that I'm going to ask you has nothing to do with your health. I am going to ask you, how many employees does your company have? And a lot of people will be like, well, Brittany, what does that have to do with Medicare? And the answer to that is a lot, like a whole lot. Because simply telling me that I have insurance through my job does not tell me enough to know how Medicare should now coordinate with said coverage, right? Now, generally, if you are 65 or older and your employer has 20 or more employees, the employer group plan will pay first, Medicare pays second. Or you can actually choose to delay, if you're still actively working, you can choose to delay your Medicare without being penalized, right? No penalty. I know everybody's talking about the penalties. That's what you're trying to avoid. If you are actively working and your group coverage has more than 20 employees on this coverage, you technically can delay your Medicare without being penalized. Now, if your employer has fewer than 20 employees, generally Medicare is going to be your first payer, right? And that employee coverage, if you have it, right, will be your secondary. Now, why does this matter? It matters because I meet a lot of people, but I have met people specifically who assumed that because my employer will let me stay on the plan, I'm fine. And that's just not enough data, it's not enough information. Those are two different questions. Your employer allowing you to stay enrolled does not automatically tell you who is supposed to pay first. And if Medicare is supposed to be your primary and you didn't enroll when you needed to, you can create that situation where one, your employer plan doesn't pay the way you thought it would, right? Or you end up with penalties on the back end. So before you turn 65, go to HR, ask them this question: how many employees are in our group? Or if you work at a big corporation, you probably know, but you got to make sure you know. And is this coverage based on my current employment? My current employment, that's a big thing. Sometimes people are retired and they're getting group coverage from a retiree group coverage, right? But they're working elsewhere. Well, that's not considered creditable. You have to have coverage where you're currently working, right? How does the plan coordinate with Medicare when I turn 65? That's a question. And is my prescription going to be covered? Is my prescription coverage that I have considered creditable for Part D? And get your answers. Preferably get them in writing, right? Because this is one of those areas where I don't want you taking Medicare advice from your coworker who turned 65 3 years ago. Their situation just might be different than yours, and that's just the fact, right? And so if you're working past 65, comment 65, watch my Medicare webinar before you make any changes to your employer coverage, and let's make sure you get Medicare done right the first time. Talk soon.